Hi, my name is Chen. I'm come from Department of Orthopedics of Ruijin Hospital, Shanghai Jiao Tong University. I'm going to share my paper titled Effects of Posterior Tibial Slope on the Medial Results of Medial Unicompartmental Knee Arthroplasty, published in Arthroplasty. UKA has the advantage of minimal invasiveness, less bleeding, and faster recovery. It has become a popular alternative to TKA, with great patient satisfaction and favorable functional outcomes. Despite the success, complications in UKA is not uncommon to be reported. The prosthesis loosening and land wear, which are associated with the malalignment after UKA, accounted for over 50% of the reasons for UKA revision. Therefore, the accurate positioning of implant is a critical factor for implant longevity. Posterior tibial slope may directly affect implant stability, postoperative joint mobility, and the wear rate of prosthesis. In this study, we retrospectively investigated the effects of PTS on the knee function in the medial term after medial UKA, with the attempt to find out surgical strategy for the tibial plateau osteotomy in the medial UKA. We retrospectively analyzed the records of 113 patients with medial unicompartmental knee osteoarthritis who had undergone medial UKA between April 2009 and April 2014. The patients were followed up for HSS scores, post-operative complications, and AP and natural radiographic results of the knee. In the physical examination, we employed a protractor to measure the range of motion and the maximal flexion range of the knees. All surgical procedures were performed by myself using the same prosthesis implant. In terms of the angle of PTS measured, patients were divided into three groups. Group 1 is less than 4 degrees. Group 2 is between 4 to 7 degrees. Group 3 is more than 7 degrees. Of 124 knees included in this study, 19 knees were in Group 1, 45 knees in Group 2, and 16 knees in Group 3. The post-operative HSS scores averaged 91.7 at the last follow-up, being virtually 40 higher than the pre-operative HSS scores, indicating that the clinical effects was excellent. As shown in the table, we are ready to draw the conclusion that the PTS exerts little effect on the post-operative functional recovery after medial UKA in a certain range. During the follow-up period, the insert exchange was performed on one patient due to the impingement of residual semen, and 4 patients received revision surgery with TKA. Our main finding was the value of postoperative maximal knee flexion was significantly lower in Group 1 than in Group 2 and Group 3. This finding indicated that the PTS has an impact on the maximal knee flexion after medial UKA. In conclusion, it remains a pivotal part of joint replacement surgeries to properly deal with the PTS. In the tibial plateau osteotomy and the fixation of the tibial prosthesis, a too small PTS should be avoided. PTS within a appropriate range 4 to 7 degrees can help achieve the maximal knee flexion after medial UKA. If you have any questions and ideas about this article, please feel free to contact me. Thank you.